With more than 10 years of experience, now when I look back to the time that I was at dental school, there was one crucial skill that they have never taught us at dental school, and it was so important in our daily practice. That is communication skill. Because when I think about the time that was the school, I only observed how other dentists or lecturers or other seniors communicated with the patients. I formed a way of communication by myself, and I thought that would be the right way or the correct way to communication with the patient. It also plays an important part whether I was at the hospital based or was it a private clinic based. It somehow influenced the way I talk to the patient. From that point until now, that's how I always thought I communicated quite well. But there's actually 3 parts of the communication skills that are super important that you have to master from day one at dental school. The first one is how to explain the procedure to the patient in a very simple way without any professional terms. Because I remembered once upon a time, I saw a dentist explain to the patients and he using the hole instead of the caries or cavities, and it was like, oh, it's not professional to use like a very casual term, but it's actually worked because that's how the patient understood the concept, not a very professional fancy terms that no one can understand. The second thing, when the patient understands what you're explaining, it will increase the acceptance rate, which is super important for you in real life, because you can have all the skill in the world, you have been to 10,000 courses, you have all the knowledge, but if you cannot explain it to the patient, then they don't understand what they get into, you have very low acceptance rate. In very early of my career, I thought, okay, is there a problem if they don't get it? But then eventually it's actually, you find it a struggle because you wanted to do it so much for the patient, but if they don't get it, it's very hard for them to accept your treatment plan. And finally, is how to handle the patient's complaints. It is something very dark and almost no one wants to deal with that, but it's a part of the reality because there's sometimes the things didn't go as it's planned, or people just have different experience and expectation. How do you handle those things? It's never been taught. If you look into the textbook, they always have the list of the questions of what to ask, but not how to ask it. So, my friends, if there's one skill you need to master right now when you're at dental school or in very early stage of your career, that would be mastering the communication skill.